Welcome. We'll let folks join into the Zoom room. For those that this is your first CLEC webinar, we welcome you. To those that are joining us again, we thank you for coming. We're excited to introduce the Community Living Equity Dashboard. Next slide, please. Before we get started, I'd like to review a few housekeeping measures. Please take a moment to enable your needed accessibility features, including Zoom captions, as well as ASL. We also envision on having a chat. We also envision on having a very interactive discussion today. And so we hope that you will engage your questions within the Q&A, as well as engage with us within the chat. A special thank you to our communications team that is helping to support this event. If you need help enabling your needed accessibility features, please be sure to either raise your hand or to indicate that in the chat. Just for a note, we will intend to share the PowerPoint slides, a post-webinar FAQ, as well as intend to answer any questions that we're able to get to during the duration of this webinar. Next slide, please. A special thank you to our funders. The contents of this dashboard were developed under grants supported by NADLR and RWJ, the Robert Wood Johnson Foundation. We are so excited to convene a diverse group today of advocates, policymakers, researchers, and many more stakeholders interested in learning more about our new interactive dashboard. But since you all are here, I invite you all to share your name, your affiliation, and also your state within the chat so you can also get to know who's in the Zoom room. Next slide, please. Thank you. It's a pleasure of mine to present on screen with two distinguished and passionate professionals. For those that don't know me, my name is Jennifer Lee Rambarose, and I serve as a research associate too with the Lurie Institute. And I also serve as project coordinator for the Community Living Equity Center. I join you as a brown-skinned African-American woman wearing my hair in a natural blowout today. And I also have a Brandeis Lurie hoodie on today that's in a blue color as well. I'd like to invite the other panelists, both Hannah and Lauren, to briefly introduce themselves as well. Name, affiliation, title, and a brief image description, please.
I can jump in. Thanks, Jen. Hi, everyone. This is Lauren Bixby. I am a research scientist at the Lurie Institute for Disability Policy and work closely with the Community Living Policy and Equity Centers. I am a white woman with shoulder-length brown hair, wearing glasses and a kind of little aggressive pattern going on with my black and white pattern shirt. And I have a blue Brandeis background behind me. Thank you.
Hello, everyone. My name is Hannah Diamond. I'm a policy advocate at Justice and Aging. A big thank you to the Community Living Policy and Equity Centers for having me. I am a white woman in my 30s. I have frizzy curly brown hair that's in a half-up ponytail. I wear brown glasses, and today I too have a patterned shirt on. It's a darker colored shirt, and I have a blurred background behind me.
Thank you all. Next slide, please. So it's important today that we also discuss our desired outcomes. We have so many folks here that are approaching this webinar with many different interests. And so for today, we envision that this webinar will advance your understanding of a CLE equity dashboard, further develop your skills on how to utilize the dashboard, as well as identify how the dashboard can help support disability community, diverse stakeholders to advance data-driven responses for equity and policymaking. Next slide, please. The CLEC Community Living Dashboard was created by the Community Living Equity Center. This dashboard displays our commitments to knowledge translations by supporting our commitment to technical assistance, Our website offers a FAQ, a feedback form, tutorial, and toolkits. I think it's important to note that soon we will be having both a Spanish-speaking messaging toolkit as well as Spanish website translation, which will support our capacity to aid knowledge translation as well as capacity building across diverse stakeholders. Next slide, please. This data dashboard maintains three sections. On screen, you will see a screenshot of the web page that houses the equity dashboard. And there are three main sections of the dashboard. Who needs HCBS, which is supported by American Community Survey data? Who receives Medicaid LTSS, which is supported by MTSS data? And also a third tab, which reflects disparities in existing and access and home and community-based services, also known as HCBS, which will be coming soon. This dashboard includes the percentage of demographic characteristics of racial and ethnic minorities with LTSS needs and their utilization of Medicaid home and community-based services and institutional LTSS services by various racial and ethnic categories, as well as other indicators of community living equity. Folks that utilize the dashboard, users of the dashboard, can filter to factors such as disability, age, gender, socioeconomic status, language, and more. This dashboard estimates gaps in data collection and to address limited understandings of disparities amongst people of color within community living. To bridge this gap, we designed a dashboard that offers comprehensive data all in one place. Next slide, please. Despite its limitations, using ACS data for this dashboard allowed us to offer data on LTSS need in individual states and among specific populations within those states. It's important to note that persons with disabilities were advised at all phases of the development of the dashboard and at all phases of the dashboard design process. We remain thankful for our staff and consultants that continue to devise in the development of this tool and aid in accessibility. It's important to discuss why this dashboard is important. People with disabilities deserve to live independently and in the community. This data can aid in advocacy and HCBS services, assess unmet need and utilization, anticipate expenditures, and also aid in equity analysis. We also believe that the dashboard can have diverse benefits of addressing institutional bias in Medicaid and also seeking to explore whether existing services fulfill the promises of Olmstead, the setting rule, and the access rule as it relates to advancement and advocacy. We think it's important to enable diverse sectors across healthcare, policy, research, and advocacy to address unmet need and utilization by supporting policymakers who address CMS, Medicaid, and Medicaid funding, advocates who are seeking to preserve home and community-based services and other long-term services supports that enable community living, and also supporting the advocacy of families seeking to explore expansion of services to meet their continued unmet needs. And also supporting local officials from various sectors, city councilors, mayors, and disaster planners that are looking forward to assess both utilization and needs of persons with disabilities in the future. More importantly, and also just as importantly, I should say, we are so excited to continue to inform the next generation of researchers by offering comprehensive national data in a usable, accessible platform. This will inform the capacity of those interested in equity and expanding LTSS need. These are just a few examples of how you all can apply this data and the dashboard to what you do. But we're excited to hear from you. I welcome you to share in the chat, what are your intended utilization of the dashboard? And how can you see it advancing your goals? And if you're unsure, email us or put your favorite emoji in the chat and we'll be sure to connect with you so we can help you explore how this dashboard relates to what you do. Lauren? Next slide, please.
Hello, everyone, and thank you, Jen. We are so excited to share the dashboard with you all. So I'm going to be talking more about kind of the data that we use and diving into a demo. So in terms of the tab of the dashboard that looks at who needs LTSS, this comes from data from the American Community Survey, or ACS, and we use the 2021 5-year sample, which helps to improve the accuracy of our data. And the ACS is a nationally representative survey that's conducted each year by the US Census Bureau. And for our dashboard, we're specifically focusing on the sample of adults ages 18 and older in the United States. So next slide, please. So how are we defining who has an LTSS need? So we consider a person to need LTSS if they report a self-care and or independent living disability in the ACS. So the ACS asks a series of 6 different questions. The one on self-care asks if the person has serious difficulty with dressing or bathing. And then the independent living disability question asks if they have difficulty doing errands alone, such as visiting a doctor's office or going shopping. And in both cases, the disability must be due to a physical, mental, or emotional condition lasting at least 6 months, so not necessarily just temporary conditions. So next slide, please. We estimate that about 6.8% of all adults in the United States need LTSS, but this varies quite a bit across states. So states with the highest percentage of adults who need LTSS include West Virginia at 10.2%, followed closely by Arkansas, Mississippi, Kentucky, Alabama, New Mexico, Louisiana, and Oklahoma. In just a bit, I'll give a demonstration, but first let's shift gears to talk about the who receives Medicaid LTSS dashboard. So next slide, please. Thank you. So to determine who receives Medicaid LTSS, we use data from the 2021 Transformed Medicaid Statistical Information System, it's a mouthful, or TMSIS. So TMSIS is a CMS system that collects data that's state reported, so it's Medicaid claims data. And for the dashboard, we're focusing specifically on adult Medicaid beneficiaries who receive LTSS. So while TMSIS is known as the most comprehensive data that we have on Medicaid for US states, there are some concerns that we want to point out, particularly with the quality of the data. So next slide, please. So this US state map on the screen comes from a brief that we will be sharing hopefully very soon, where we assess the quality of race and ethnicity data, specifically among LTSS users. So states are marked here in red, denoting if they're high concern states, if 20 to 50% of adults with HCBS in that state are missing race ethnicity data. This includes states like Massachusetts, New Jersey, Florida, Indiana, Arizona, Utah, Iowa, South Carolina, Kentucky, DC. So even states, though, that are marked in yellow or green as medium or low concern based on the percent of missing data can still have problems with how accurate the data is and how it reflects the actual racial and ethnic distribution of LTSS users within that state. So it's just important to be aware of the problems with the data. States like Alabama and Mississippi here are excluded because they have kind of some major issues with the quality of their LTSS data or the demographic data in the files. But despite its issues, TMSIS still provides incredibly useful information about Medicaid, and we just need to be aware and keep pushing for improved data quality and reporting to TMSIS. So next slide, please. So Medicaid LTSS includes home and community-based services and institutional services. There are actually many different ways that organizations define HCBS, which is why you might see other reports, such as from Kaiser Family Foundation or MacPac, for example, that might have different HCBS numbers than what we're presenting here. And so we're specifically following the method used by CMS in their recent LTSS annual expenditure and user reports that are put together by Mathematica. And the CMS method that we're using is based on the definition of HCBS that's in the American Rescue Plan Act of 2021. So here HCBS includes 1915C waivers, 1915I HCBS state plan options, 1915J self-directed personal assistance services, Section 1915K community first choice, PACE, personal care services, home health, rehabilitation, case management, and private duty nursing. And then institutional LTSS includes services provided in nursing homes, mental health facilities, and intermediate care facilities for individuals with intellectual disabilities. Next slide, please. So states with the largest number of adults who receive Medicaid LTSS, which in part just reflects larger state populations, but potentially also more robust LTSS programs. These states include New York, Pennsylvania, Ohio, Texas, California, Illinois, Michigan, Oregon, and Florida. And I do want to note that our estimates are likely undercounting people who receive Medicaid LTSS in many states due to TMSIS reporting issues. For example, we know that this is the case in California as they have their own LTSS data dashboard that we can compare to. But next slide, please. So overall, we find and present in the dashboard that about 17.6 million adults need LTSS in the US, whereas 6.4 million adults receive Medicaid LTSS in the United States. So the second number, though, is excluding Alabama and Mississippi. Next slide, please. So you might be wondering why there's such a large discrepancy. Part of the story is that not everyone who needs LTSS necessarily qualifies for Medicaid, for example, based on financial eligibility criteria, and this can vary by state, but Medicaid is the primary payer of formal LTSS in the US. But we also might see this discrepancy because a lot of people might be receiving LTSS or supports through kind of alternative sources. So this can include Medicare, particularly for more acute or post-acute care situations, such as after a hospitalization for a temporary time. This can include private long-term care insurance. And a lot of people end up having to pay out of pocket or rely on informal supports and unpaid caregiving to meet their LTSS needs. Additionally, this large discrepancy may reflect unmet LTSS needs. So we need to be pushing for improved access to services and quality of LTSS. So next slide, please. All right, so now we are going to dive into a demonstration. So I'm going to share my screen here. Hopefully no technical issues. There we go. I'm going to minimize here. Okay. So here is the homepage of the Community Living Equity Dashboard. You can navigate to the different tabs from this page, and we also provide an introduction to LTSS in our dashboard. And if after this you'd like to check out our tutorial video, this is another helpful source for learning more about how to use the dashboard. I'm going to scroll back up. And now we're going to navigate to the Who Needs LTSS tab, which looks at what adults in the United States need long-term services and supports. So let me scroll down. Under this descriptive statistics for the United States heading, we can see the number of adults who need LTSS. This is that 17.6 million. And the percent of adults who need LTSS in the US, which is 6.8%. And in this case, since we're looking at the national level, all of the states in this map are going to be shaded blue. So then if we scroll down, we can see the percent of adults who need LTSS by sex, race, ethnicity, age group, primary language, poverty status, and rural status. And there's also an option towards the top here where you can filter if you're only interested, for example, at looking at female adults or a particular race, ethnicity, or age group. You can filter there. But if you're interested perhaps in looking at a particular state, there's a drop-down menu at the top called State Select. So you can choose, let's say, Georgia. And now you're going to see that only Georgia is highlighted in blue in the US map. And the descriptive statistics now are just referring to adults who need LTSS in Georgia, which is about 540,000 adults. And then if we scroll down, we can again see the percent of adults now in Georgia who need LTSS across these different demographics. If you're only interested, let's say, in looking at someone or at adults who are under 65 years old in Georgia, you can select that filter option, and then these numbers will shift in accordance to only look at the under 65 population. So here under age group, you're going to notice that now this is 100% because we've filtered to that population. If you want to clear your state or filter selections, there's an arrow that is labeled Clear Selections. So this will take you back to just the national level with no filters selected. But if you only had wanted to filter by a certain or kind of clear your selection of a certain characteristic, such as the age group, but still look at Georgia, you can kind of hover above any of these drop-down menus, and there's an eraser to clear your selections there as well. And if you prefer, though, to look at tables, if that's more accessible for you, or if you're maybe more interested in some of the specific numbers, there's a table view option at the top corner that you can select. And this is going to have the same state and demographic filter options, but now we're going to be looking at a table view of the adults who need LTSS and the percent of the population that you have selected who needs LTSS as well. If you need to, if you're kind of going through the dashboard and have some questions that come up there, we do have an FAQ at the list of questions at the bottom of the dashboard. So this talks about kind of why we chose this data, how we define different variables, why we can't necessarily look at other intersectional identities that we might be interested in given data limitations. So this can be helpful if you have questions. And then if this doesn't answer your questions, we also provide our email address, clequity@brandeis.edu, if you encounter any accessibility issues or would like to reach out to us. And we also have a survey that you can take to provide feedback. But now let's, here at the bottom, if your screen is bigger, you might see it on the top left, but here it's at the bottom where you can select a different web page. So we're going to go to Who Receives Medicaid LTSS now. So for some reason, this is looking a bit small. There's an option at the bottom to zoom in. There's a sliding bar. So we're going to try to make that a little bigger. And so this dashboard is set up very similarly to the previous one. You may notice here in the map, again here, that Mississippi and Alabama are excluded, and that's due to the data limitations we talked about earlier. But here you can select by state, by the type of Medicaid LTSS service. And under our descriptive statistics for the US, we show the number of adults who receive Medicaid LTSS, and then who receives HCBS, institutional services, and then those who receive both types of services within the same year, we've separated out here. And we have the same filter options. Here we don't have information due to data quality issues for the other characteristics we were looking at on the Who Needs LTSS tab, but we can still look at sex, race, ethnicity, and age group. And we're comparing here kind of the percentage of adults who receiving LTSS who have HCBS versus institutional services. And then the little gray in the middle of the bar graphs are going to be those with both types of services. So if you are interested maybe in looking at Massachusetts or a specific state, you can again go up to the state select option. We're going to scroll down Massachusetts. So now Massachusetts is the only highlighted state. We see about 175,000 adults in Massachusetts receive Medicaid LTSS. And you're going to notice here this big note that says data not available due to quality concerns under the race ethnicity section. And so this is one of, I think, 16 states that we have to exclude race ethnicity data for because they've been marked as high concern or unusable race ethnicity among Medicaid beneficiaries overall. So we list these states in the notes, and we do encourage everyone to kind of push your state to improve their data quality and reporting so that we can look at disparities and try to address disparities across all states. But let's look at a state that maybe has available race ethnicity data. So I believe Oklahoma does. So here we see about 50,000 adults in Oklahoma receive Medicaid LTSS, and we do have race ethnicity data for this group. If you were, for example, only interested in looking at like how many male adults who are American Indian or Alaskan Native in Oklahoma receive services, you can specifically filter to that group by selecting those filters. We're going to see that's a little over 1,000 adults. And so these numbers now we're going to have the other categories, female and the other race ethnicity groups, drop out. And so we only have the bar graph for male and American Indian, Alaska Native, but can still compare across race or across age group here. But if maybe you're only interested in looking at people who receive HCBS in Oklahoma. So we're going to clear our selections for race ethnicity, clear our sex selections, and go up to the top and select only HCBS under services received. So we see that's about 31,000 people. And this is going to look pretty weird on the bar graph mode, where you have 100% across all of the bar graphs, because now we're not comparing to institutional LTSS or people with both types of services. So this isn't as helpful of information, but if we switch over to the table view and we want to go back and select Oklahoma, let's see, Oklahoma and only HCBS, we now have more specific data of the exact numbers of people who receive Medicaid LTSS and then the percentage of adults who receive LTSS who fall into each subpopulation category. So the table view is definitely going to be more useful if you're interested in filtering to a specific type of service. Again, we have our list of frequently asked questions, where the data comes from, explaining a lot of the data quality issues, how we calculate LTSS. And then at the bottom, again, we are very eager to receive your feedback and questions. So feel free to share your thoughts there. But I think now we're going to go back to the slideshow if possible. So I'm going to stop sharing. And so if you have any specific questions, I think we already have some in the chat, but if you want to put in the Q&A box questions about more specific kind of data questions or technical questions of how to use the dashboard, please feel free to put those in the chat and I will go through them, and hopefully at the end there will be some time to get to those, and we'll definitely be getting to everyone's questions in a frequently asked question document after the webinar has concluded. So please enter your questions, and I'm going to turn it over now, I believe, to Hannah to talk about how this can be useful from an advocacy perspective. So thank you.
Thanks so much, Lauren. Hello, everyone. Again, my name is Hannah Diamond. I use she, her pronouns. I'm very excited to be with you all today and to be talking about this wonderful dashboard. A huge kudos to the Community Living Equity Center for all of their work with putting this together. I'm excited to talk to you about opportunities to apply this dashboard to advocacy. Next slide, please. For those who might not know us, Justice in Aging is a national organization that uses the power of law to fight senior poverty by securing access to affordable health care, economic security, and the courts for older adults with limited resources. We've been doing this work for over 50 years. Our efforts are focused primarily on those who have been historically marginalized and excluded from justice. This includes communities such as women, people of color, LGBTQ+ individuals, and people with limited English proficiency. Next slide, please. So I want to start with talking about the institutional bias within Medicaid. As was mentioned earlier in the presentation, Medicaid is the primary payer of long-term services and supports. So federal Medicaid law requires states to cover care in an institution, like in a nursing home, but it does not require states to provide the full range of home and community-based services that an individual needs. I'm going to be using the acronym HCBS on the slides to denote home and community-based services. So what this means is that someone who needs long-term care is only guaranteed services in an institution, and accessing care in the community, accessing home and community-based services can be very challenging for older adults and people with disabilities. There is variation between states. There's often variation within states. So there are a lot of challenges and barriers that individuals experience. There have been significant strides over the last few decades that have been made to address this institutional bias and to increase access to care in the community. I've listed some of those on the slide, and I just want to celebrate them. You have the Supreme Court case, the Olmstead Supreme Court case. This case affirmed individuals' rights to receive services in the least restrictive setting possible. You have federal rulemaking, such as the settings rule, which differentiates home and community-based services from institutional care. You have the access rule, which came about last year, which again is trying to remove barriers to accessing home and community-based services. You had an influx of money that went to states through the American Rescue Plan Act. It allowed states to expand their home and community-based services. We saw a lot of innovation because of the use of these funds. You have programs like the Money Follows the Person's program. This program transitions individuals, out of institutions and into the community. And there are other activities that are happening at the state and federal levels that I'm sure many of you are involved in. But data is a really key piece of this work. Data helps us understand where we need to be targeting our policies. Data helps us understand whether or not a policy is working. And so data is a really critical piece of addressing barriers to care and addressing unmet need. Next slide, please. So I wanted to give a little bit of background on some of the data in this space up until this point. When it comes to LTSS data, so long-term services and supports data, especially in the context of disparities, the majority of the data that we have in this space has been focused on nursing facility care or Medicare home health care rather than home and community-based services, in part because there's such significant variation across states. And when we have had data on LTSS use and disparities, sometimes that data is limited. Various reports can contradict one another. There's inconsistent findings. So this is a real need when it comes to home and community-based services. And as I mentioned earlier, data is really critical. It is a key component of rebalancing funds away from institutionalized care and putting more resources towards services in the community. There's something common in this space called a rebalancing ratio. Rebalancing ratios analyze expenditures of home and community-based services out of the total long-term services and support spending. And while a rebalancing ratio is helpful, it often masks disparities. So it's difficult for us to understand if there are particular populations that do not have access to services. I'm going to give you an example of this. We know because of discrimination and discriminatory policies that particular populations incur a higher prevalence of illness and a higher prevalence of poverty. And these facts, combined with Medicaid's institutional bias, results in specific populations experiencing increased risk of institutionalization. And so the example here is that compared to their white counterparts, Black older adults are nearly twice as likely, and Hispanic older adults are nearly 1.5 times as likely to have Alzheimer's disease and other dementias. And therefore, they are more likely to be institutionalized. They're at greater risk. And so that's why we need tools like the data dashboard to help us identify these disparities and target our policies. Next slide, please. So I wanted to give a little bit of background on some of our advocacy efforts in this space, and Justice and Aging has been doing this work in collaboration with other aging and disability partners and advocates. We have been working with CMS, the Centers for Medicare and Medicaid Services, on efforts to improve LTSS data. Specifically, as Lauren mentioned, on an annual basis, CMS releases an LTSS expenditure report. And the most recent report used TMSIS data, which is the same data that informs the Who Receives LTSS tab of the dashboard. And so I just wanted to highlight some of our priorities related to this work, some of which we've had wins in this space, so it's exciting to celebrate and recognize those wins. First, we encourage CMS to switch the data set that they were using for these reports to TMSIS. As Lauren mentioned, there are some quality concerns with TMSIS, but it is a very robust data set that allows us to conduct analysis by differing demographic characteristics. So CMS, excuse me, is now starting to use the TMSIS data set. Currently, we are advocating for increased or enhanced quality of the TMSIS data. Lauren talked about the race and ethnicity concerns across states of that specific data. There's also significant variation in terms of how states are reporting the information beyond just the race and ethnicity data within the TMSIS data set. So there's variations there. There's different codes that are used by states, which impacts the overall quality of that data set, and then corresponding analyses. So this is something that we are actively working on with CMS and encouraging them to encourage states to improve their reporting specific to TMSIS. We have advocated for analysis of LTSS use by demographics so that we can understand the users of these services, and also by delivery system. So whether that be managed care or fee-for-service or PACE, to help us, again, identify models that are addressing needs and various impactful approaches that we can expand. And so the most recent report did include both demographic analysis and delivery systems analysis. We're also advocating currently for improved presentation of the data. I think that this data dashboard that you all saw earlier, demonstrated by Lauren, it is very accessible, and there's been a lot of thought and consideration that goes into developing this tool. And so we would love to see CMS uplift some of these best practices developed by CLEC. Additionally, we want CMS to be more transparent about the limitations of the TMSIS data set. And then finally, we are working to improve the reporting of the race ethnicity data that Lauren noted earlier. Next slide, please. When it comes to unmet need, there has been a long-standing advocate ask for reporting on the difference between when services are authorized versus when they are received or utilized. And there have been some significant wins in this space. Last year's access rule contained various reporting requirements for states. So an HCBS waitlist is often used as an indicator of unmet need. So states are going to have to report how they maintain their wait list, the number of people on their wait list, and the average amount of time on a wait list before being approved for services. States are also going to have to report various access service related data points specific to home and community-based services. So the time between when an individual was approved and then first provided with services. So this will help us understand and again target our policies to address where there is a barrier in the HCBS infrastructure. I want to note that there are limitations here. This portion of the access rule is not supposed to, or will not, states do not have to come into compliance with this segment of the access rule until July of 2027. The other thing is because of the Trump administration, myself and other advocates are concerned that this rule may not be implemented in a meaningful way. And so that is a concern regarding these wins. The other thing that I want to note is there are good reports when it comes to wait lists, for example, from KFF, but these reports are not interactive. Advocates or researchers cannot analyze the data by a specific demographic characteristic. Next slide, please. So this is where the void is really filled by this particular dashboard. Yes, there are concerns with the TMSIS data set, but given that it is one of the most robust data sets that we have, this dashboard is providing individuals, advocates at the state and national level with an understanding of the LTSS infrastructure in their state. This tool is one of the first of its kind in terms of accessibility features, and it's also interactive. So it enables you as a user to analyze the data by a specific identity or set of identities so that you can understand the compounded impact of identities on access. And then it allows you to compare both received and needed services, again, so that you all can be working to develop the HCBS and LTSS infrastructure in your states that meet individuals' needs. Next slide, please. So just some ideas in terms of how we can apply this dashboard to advocacy. Even before I get into these examples, I want to give you an example of how I've already used this tool. I do advocacy in New Jersey, where I am working alongside aging and disability advocates to expand access to home and community-based services. And in the state has an LTSS dashboard that contains information only for one Medicaid pathway. There are many different ways that individuals can access these benefits. And so there has been a huge void in my knowledge gap in terms of who is receiving personal care services through another pathway, the state plan benefits. And because of this tool, I was able to gain a more comprehensive understanding of the LTSS landscape that I am actively advocating in. So that is very, very exciting. The next kind of use case here that I would highlight is an equity analysis. It's really important for us when we're thinking about pursuing a policy or even pursuing litigation to understand how our actions are going to impact particular populations and if they are in fact addressing unmet need. Also, this tool allows us, even before we have a policy idea, to identify target populations that are experiencing barriers that we need to address through policy. Another key idea here is Medicaid defense. I think that this is going to be a big priority for our groups collectively in the next few months and over the next few years, quite frankly. So to protect the existing services that are available in your states, I would encourage you all to use the Who Receives Medicaid LTSS tab, and specifically to leverage the demographic information that is available through this portion of the tool so that you can tailor your messages to specific audiences. And then finally, this tool or this dashboard is wonderful also for Medicaid expansion. As much as we're going to be working to defend what we already have, we need to also be on offense to address unmet need. And so the Who Needs LTSS tab is critical for that, and I'm going to give you an example. In New Jersey, again, I am working with advocates to expand the financial eligibility criteria for Medicaid pathways that impact older adults and people with disabilities. Right now, these populations are subjected to more stringent income and asset criteria than other Medicaid recipients. And when these populations enroll in Medicare, they often lose their Medicaid coverage because of these more stringent thresholds. So this tool, using the poverty status information that is available, will help me to understand if I were to propose an income increase, how many individuals would become newly eligible for benefits. It will help me quantify the cost of that proposal and then go to a policymaker with armed and equipped with that data to develop robust legislation to address these inequities. So it's very exciting. Next slide, please. Here are some resources for you all to consider based upon what I have spoken about. Next slide, please. And thank you so much. My contact information is here if anyone wants to learn more about advocacy strategies using this tool. So thank you. And with that, I'm going to pass it off to Jen.
Thank you so much, Hannah, and thank you so much, Lauren. We do still have time to address some questions, and so I wanted to ensure that I open the floor back up to Lauren to address any questions. We also have been trying to respond to what we can within the Q&A segment as well. I want to mention to attendees, I know there are diverse stakeholders in the room today, that we have an interest in continuing to advance your capacity to utilize this dashboard. So please continue to email us to ask questions, as well as seek our partners such as JIA, who are continuing to advance work around advocacy and equity. Lauren, any questions you'd like to address regarding dashboard design? I know we have a few in the chat and also a few more minutes with folks in the Zoom space.
I can try my best to address questions. I know there are a couple questions, I think, related to whether we can filter by disability type or look separately, like why do we look or combine kind of self-care and independent living disabilities rather than looking at them separately as well. And part of this really is due to kind of complicated statistics going on in the background that our data team identified that when we can look at these things separately in the ACS data. However, for our dashboard, because we're allowing people to filter by states and by these different demographic factors, once you apply these filters, you get down to these really small sample sizes that make the data unreliable. And so we don't want to share data that we can't say that with confidence that this is necessarily reliable or accurate. And so for the dashboard, we're not able to necessarily, but I do think that it is important to be thinking about like, how does this vary for people with IDD or physical disabilities and different disability types? So I think those are great questions. And I know I saw another question, I think, about California specifically, and I know maybe Hannah might have more to add on to this, but California has been we've been shaking our heads trying to figure out what might be going on. We think that a lot of the numbers are like underestimated for many states, and we know for sure with California that this is the case given existing data that we can compare in California, but the HCBS does include the 1915J waiver, so it should, in theory, be including HCBS delivered through California's IHSS program. I think that one of the biggest issues really that's going on is just that this data is not getting reported into CMS, into this TMSIS system accurately. And so I think that is largely like undercounting, particularly certain services. And I don't know, Hannah, if you wanted to add anything there.
I'll just even broaden that further. I think that states need technical support from CMS to ensure that they are reporting the information in a standardized way. And we think that's what's happening in California, to Lauren's point. Like there's something wrong with how the information is being coded so that it's not accurately being included within the TMSIS data set. So to bring it up into a bigger advocacy priority, states need more technical assistance, and then advocates at the state level need to be applying pressure from the ground up, holding their states accountable to make sure that this data is accurate.
Thank you so much. Just saw another question on kind of how is the rural indicator measured that we are using with the ACS data, and it is measured using the U.S. Census kind of definition of rural status. Let's see. I want to try to make sure I'm getting to different questions. I see a question about, will the dashboard provide ways to search for different types of services, including new innovations, services to caregivers, and any ties to critical incidents? As of right now, our dashboard is not able to speak to that, but we are currently doing research and looking at different service categories and racial and ethnic disparities in different across different service categories specifically, or across different kind of disability type subpopulations. And so hopefully some of that will speak more specifically to services relevant to caregivers or other services as well. Let's see. I don't currently know of any data specifically collected to list that focuses on people who have lost LTSS or become institutionalized due to disaster specifically, although I am in agreement that this is very important right now with the LA fires that are ongoing. And so I think that as people lose access to their homes and communities, and people with disabilities being disproportionately impacted, I think this is something we do need to be monitoring and pushing for data. And if anyone in our large webinar knows of any data, please feel free to put it in the chat. See a question in the chat about whether there's data on staff vacancies in office of public assistance. I don't know. I think that may exist in administrative data, but it's not something we have in the TMSIS, like Medicaid claims data. I think there's been a couple questions as well in the Q&A in chat asking about putting together the who needs LTSS and who receives LTSS tabs like more closely so that it's easier to compare. And why we do have them separate is because they're such different samples, one being survey data from a US population overall, and us, I guess, focusing on adults, but then the other coming from Medicaid claims data. Because they're such different samples, we don't necessarily want people to take away exactly that 6.4 or like million out of the 17.6 million people who need LTSS are receiving LTSS. And so we do think, though, that there are important disparities to point out. And so they're in the disparities in LTSS tab that Jen mentioned at the beginning. That is going to be coming soon. It may be slightly less interactive than the current tabs, but we're going to have data on disparities specifically using the TMSIS data to show particularly racial and ethnic disparities in access to HCBS. Trying to see if I missed any questions. Do others have kind of broader questions as well that you want to ask? We can get to more specific data questions after the webinar too, if folks have additional questions.
Lauren, I believe I saw a question in regards to the decision to utilize ACS 2021 data as opposed to other years. I'm hoping you could speak to the reasoning behind that determination and how it relates to quality.
Absolutely, yeah. Thank you. So that is the reason we focused on 2021 data. There are more recent years of data, 2022 and now 2023 is available. But we use the 2021 data because this is the most recent year of the TMSIS Medicaid claims data that we have access to. We're trying to get more recent years, and that is in the works. And so as we get more updated data for the TMSIS, will also be updating the ACS data to use more recent years of the data as well.
Thank you, Lauren. And thank you so much, Hannah. Your perspective on advocacy was so helpful for today. To our diversified attendees, thank you so much for your engagement in the chat, for your engagement in the Q&A, and your commitment to exploring LTSS need and utilization amongst persons with disabilities. I want to remind you all of how you can continue to connect with me as well as Lauren at the CLEC. So please feel free to scan the QR code on the screen. We will also be sharing our slide deck with all attendees that will come with a copy of the webinar recording as well. We also ask that you all take a moment to please complete a Zoom questionnaire and survey that will help us further understand how we can continue to support knowledge translation and continue to expand and advance folks that are aware that this dashboard exists. And so we thank y'all for attending the webinar and for openly coming with your questions and transparency. And I'd also like to say, for those that are not sure how this data applies to what you do, please feel free to email us. We'd love to have a conversation about how this dashboard and the data can help support what you do. A reminder that our email is on the screen at clequity@brandeis.edu. And also, if you go on the dashboard website, there's an ongoing set of tools that will continue to support your engagement and utilization of this dashboard. And we are excited to mention that our communications team has developed messaging toolkits to help diversified stakeholders share information about the data dashboard with their networks and stakeholders. Please be sure to sign up for our listserv so that you don't miss any announcements or any supports that can aid your knowledge translation and capacity building. Thank you all for coming, and it was a pleasure seeing you in the webinar today. See you next time. Bye.